You're listening to All About Girls of Color podcast, a space dedicated to creating environments that allow girls to thrive. We explore issues and solutions that focus on removing obstacles so the natural joy and genius of girls can bloom. Join us as we dive into conversations all about girls of color and the women they become.
I'm Tanisa Kunright, the founder and executive director of Detour Empowers and the Fancy Teen Girls Leadership Academy.
I'm Gabriela Delgado, an educator and principal consultant for Saving Our Starfish.
And I'm Janedra Sykes, an equity, diversity, and inclusion certified organizational development coach and consultant and a partner in Arboreta Group.
Disclaimer. Our intention is to bring our whole selves to the conversations by bringing our professional and personal selves to each episode. Any views or opinions on the podcast are personal and belong solely to the creators and do not represent those of people, institutions, or organizations that the creators may or may not have been associated with in a professional or personal capacity unless explicitly stated.
Welcome to another amazing episode of All About Girls of Color. We are blessed to have Dr. Emily SanDiego join us today, and we're excited to learn from you. You have a lot of experience in a variety of topics, and so our task today will be, how do we narrow it down? Because I feel like we could be with you for multiple hours, actually, forever, which we would love to, and maybe there's even a part 2 or part 3, but perhaps just to get us anchored and have our audience understand kind of what they're in for today, just share a little bit about yourself, who you're associated with, and then we'll just flow right into our conversation.
Yeah, thank you for having me. Very excited to be here. So just a little bit about myself. I've been in Orange County almost all my life. I was raised here. I came here when I was 13 from the Philippines. So I've been here a little bit over in the U.S. over 20 years. Well, 20 years. And I have a master's in clinical psychology. And my Ph.D. is in public health with a focus on social and behavioral sciences. So, and I did my Ph.D. and I stepped out of California for a little bit, pushed myself to go outside of my comfort zone. And I was in Memphis. I did my Ph.D. in public health. And I was very fortunate to really be able to work with a lot of underserved communities in Memphis, working with a few faith-based organizations and really using some of the health promotion skills that I've learned in my training and working with underserved communities. And so that was very lovely. And then after my PhD, now I'm here and back in California in San Diego. I am a postdoctoral fellow at Scripps Whittier Diabetes Institute and also affiliated with Scripps Research Translational Institute. And a lot of what I do here at Scripps is doing research on how could we adapt some of like what we know like evidence-based programs related to diabetes management prevention, and how could we adapt those to racial and ethnic minority populations. And so right now, one of the things that we're doing is adapting this program for Filipino Americans, which is I never thought I would be able to do. I thought, if I could just do diabetes work, that would be so fantastic. But being able to give back to my community, my culture, it's such an amazing experience. So yeah, that's just a little bit about me.
Well, we're so glad you're here. I know we've got a variety of questions and curiosities that we're hoping you can share your expertise and shed light on. So I'll hand it off to Janedra.
Well, how I know Dr. Emily is through a mutual friend that I went to grad school with, and I'm saying I need a researcher. I want to, I want to do some research on toxic workplaces. I know that sounds like a really happy subject, but toxic workplaces for women of color. First of all, to figure out a way to amplify it and then provide some solutions for it. So that's how I met Dr. Emily. So, and I was just knew she was the one when she said she went to Cal State, Dominguez Hills, because I grew up in Carson. So she's from my hood. Yeah, we had that connection.
The instant connection.
And so, when Tanisa's going to share a story, but when I first heard this story and we were planning the podcast, I'm like, we got to talk about that. Because when I heard the story, I was like just so outraged about it. And we needed a clinical psychologist to kind of help us work through like the mental health aspects of these young girls' experiences and how as women of color we can support that in a way to help them navigate it and help them heal from it. So the story time.
And I'm trying to think of where to even start. And there's so many things that happen, just hoping that I touch on them all because the weekend was truly unbelievable. We've been to this campsite before, twice before, and I'd been also with other groups as a guest of other groups, speaking to different youth groups that also visited the campsite to have their camp experience. And the previous times, we did get questions, from the other group that was every time we went, right, as Detour with the girls, we were somehow paired with a group of white women. So I don't know why or how or the reasoning behind that. I really didn't give it much thought at first.
I have theories, but
until
that's later. Okay, yeah.
Hey,
okay.
Right. So, so the first couple of times that we went on our own as a group, the first time, we would get questions of like, oh, who are you guys? Where are you guys from? And things of that nature. General, like wanting to know more about the group, the organization, the girls, where we were from. Okay, fine. That's fine. We can deal with that. So we went back again this year. And this year was like a whole new level. And I don't know what occurred within the last, I guess, year or two because of the pandemic. We didn't get to go during that time. So we went, a group of about 25 girls. Again, we're there with a group, of white women that are having their retreat. This particular group happens to be an auxiliary of the actual campsite. So they are even more so feeling like they have ownership over the site and what occurs on the site. So we had a lot of, oh, I like your hair, and hair touching. Oh, I like your necklace, and actually like touching of the girls, which is like red flag, like very, very uncomfortable for them, even more so uncomfortable for us. We had them looking into the windows of our private conference space because we got an actual building that we were allowed to do, our programming in during the weekend, which was private, right? It was for us, for our group, and that's it. And we would see them actually circling the building and looking in the windows to like see what was going on, right? We had that happening. They had an open field area in the middle of the site, and we were playing, flag football, volleyball, normal activities that you play with kids. And we would see them congregating and just watching. We did zip lining. They were congregating and watching. And so it's almost like we became a spectacle, like there for their entertainment. So much so that where they were actually taking pictures. And so it's like, are you really interested, or are you like totally observing every single thing that we're doing, right? The worst of it all was when someone actually came into our private living quarters to tell us that we were too loud. I mean, like, just opened the door and came in. So luckily, one of our staff members, intercepted that and let the lady know, like, this is unacceptable. You cannot come into our private area. If you have a complaint, you need to talk to an adult, but this is completely unacceptable. So it was a lot of that happening the entire weekend, so much so that we told the girls to, obviously, they never go anywhere alone together, but travel in groups, because at this point in time, we don't know, what's going to occur. And then us as a staff just became really, really protective. And I continued to, complain throughout the entire weekend. And it was just unbelievable. Like, I was in a state of unbelief the entire time, like, is this really happening, you know? And it really robbed the girls of their experience to just be, you know, which was the point of us taking them on the trip out into nature, away from the city, was for, you know, from Friday to Sunday, hang out, we're going to make s'mores, we're going to, you know, just chill and have fun. But they really robbed us of that experience. And it impacted the girls in just a horrific way, because a lot of them had never experienced anything like that before, right? And so then we're having the whole conversations on race. I'm telling them about these types of things that used to occur back in the 60s and just giving them that historical perspective. And it just led to so many more conversations that we were able to like have with them. But actually witnessing them go through that experience was really tough.
Thank you for sharing. I can tell.
It was crazy.
Yeah.
Like,
and
I just eat in peace
Yeah.
without you, you know?
Yeah.
And I feel like when you were telling the story, I feel that you're feeling a little uncomfortable too. So I want to commend you for telling your story and for sharing that story. And you know, this is such a great platform that we have, and really taking advantage of this platform that we have to talk about these things and talk about how you feel about it. And but yeah, I think it's very interesting. I think these are things that, you know, as a mentor to these girls, you want to be able to have that conversation. I'm sure that the conversation is going to come up, you know, sooner or later. But I think it's one of those conversations that you want to just have on your own, not because someone else kind of pushed you to do it. And I think for me, if I was in your shoes, and I would be more hurt about it, because, you know, you want to be able to prepare more about these conversations, these very relevant and timely conversations. And I think it's very interesting that we always talk about how, you know, we're in this day and age where we think that we've kind of moved the needle. We know what's going on, but have we really moved the needle? You know, and I think one of the questions, and I wrote it down, one of the things that I think we want to kind of hash out here is, how do we support these girls, you know? And I think you pivoted so well by talking about these historical perspectives. And, you know, I think a lot of times we talk about how kids are resilient, children are resilient, but I think to a certain extent, you know, I think these are, again, historical pieces that, you know, it's good that they have this awareness, but at the same time, it's like, you want to be able to tell them at your own, you know, in your own space, not because of this very tragic thing that happened, you know? And so I think, again, it's the question that I was kind of thinking about is, how do we support these girls, you know? How do we support them? And again, I think you did such a wonderful job at pivoting. So I wanted to ask, what was their reaction when you were telling them the historical perspectives and all that?
It was interesting for them because a lot of them didn't know and they had never heard of it. And it just allowed them to be able to deal with it, because they then understood, you know, how they could potentially have been being looked at.
Mm-hmm. Yeah.
So then they didn't take it as personal, which is the key for me, because it's like, you know, don't take it personal. There's a reason why they're acting like this, and it has nothing to do with you. Mm-hmm. It comes from a whole lineage of just inappropriateness that is still continuing today. You know what I mean? And my concern is like, how do we stop them from doing this to the next group that shows up next year or next month, you know?
Mm-hmm. You know, and that brings up a very good point. You know, when Emily brought up that, you know, we talk about resilience, you know, and I'm like, I don't know if this is the correct use of the word. Resilience has almost become a fetish, right? Let's praise resilient. And my thing is, why don't we stop the people from doing the damage rather than, you know, praising our kids' ability to take it? Right? Mm-hmm. So like where is that balance to hold that auxiliary responsible for that behavior, or at the very least let them know the harm that they did.
Yeah. Accountability. Accountability.
Accountability. And I wonder what that does to the mental health, of our girls, because we can teach them not to take it personally, because I think being able to know it's a thing gives us some distance. But that shit still hurts, right? I mean, knowing it is not about you blunts the harm, but it doesn't stop it. So I think the historical piece is important. I think maybe giving them some skills to address it in real time is important, or a support system for them to discharge that experience is important, because I think it's important that you guys talk to them about that, right? Like just you guys, right?
Yeah.
Kind of.
Yeah, and I think how do we empower, girls to speak up, And I think one of the things that I'm even struggling with that as an adult, like, when can I actually use my voice? And I think as a woman of color, I'm always afraid to use my voice. And growing up, it wasn't a conversation that I had with my mom. It's not a conversation that I had with my peers, my mentors, to use your voice. And don't be afraid to use your voice. Like, how do I hold this person accountable without, getting into like the whole soapbox, and, especially if the other person is, one, unaware of what they're doing, and two, if, you feel that they would probably be defensive about it because they're so unaware of it. And so,
That's a whole nother level.
Yeah, it is. And so, and that is why I was glad that we were there, because a lot of them were saying, hey, this happened, and they weren't unsure.
They knew it was kind of creepy, right?
Right. And I was able to tell them that is wrong. No, nobody should be touching you. Nobody has the authority to put their hands on you, whether they're giving you a compliment or not. And it is okay for you to tell them no, And I said you could still be respectful while saying no. Just let them know in a respectful way that, hey, I please don't touch me.
Yeah.
Because, like, the audacity, right? What happened to, like, this is my space and you're in my space without authority, So just being able to let them know that's wrong, one. And two, yes, you can say no, and you have the authority to say no because you are the ultimate ruler of what goes on in your personal space.
And, give them, well, this is a confession. I lost it as an adult, that someone came up to me and touched my hair, a white woman, and I touched hers back without even thinking about it. Something like snapped inside, and this happened within the last 3 years, right? And you know I'm old, right? So it builds up. I just didn't want another time for someone to feel authorized,
right?
To, even though, oh, it's so beautiful.
Yeah.
And that, and that like impacts, I would think that kind of behavior, if I did that in a workplace, would be a problem, right? How do we teach them to navigate that stuff?
I think when you were saying earlier, like, you're glad that you were there. I think, again, awareness, I think that's big. And really empowering these girls to recognize when it's happening, right? Teaching them that, these subtle, it may seem subtle to some people. Oh, get over it. It's fine. It's just, I was actually listening to like a YouTube, podcast. And one of the things that they mentioned is that, microaggression is very comparable to like a paper cut. It's small. It's no big deal, but it hurts. Yes, yeah. It hurts, right? But if you have 75 paper cuts, that's miserable. That's painful. That's intolerable. Can you imagine like some of these girls that are experiencing it? But I think, recognizing it, again, growing up, I didn't know certain things that are happening to me when people would talk to me like slow, like I don't speak English, like, oh, and so shocked, like, oh, I didn't know you speak English, like, and even things like that. It's like, yeah, actually, I'm probably a lot more fluent than you. And things like that, like these, again, assumptions that it's okay. And I think, now growing up, I'm recognizing it, that, hey, these are, but then again, the question is, how could we help these girls recognize it? And I think talking about it is one. Talking about it amongst yourselves, like, I think it's a big deal. Giving the historical pieces of it, I think, is a huge deal, and it's a lot. You can probably talk to them for like an entire retreat just about that,
Yeah.
And so I think recognizing it, and I think I love what you said too about setting boundaries. How do
Right.
we teach girls to say it's okay to say no and use that voice to say no? And so I think those are the things, again, as an adult now, I'm trying to practice that because, I wish I was able to go to one of your events because I think, again, I didn't have anybody to talk to about these things. And if I had just known, I feel like I would have navigated adulthood a little bit better. So just having that space, having that safe space to talk about, awareness, setting boundaries and things like that. I think that's something I use in my personal life now and my professional life, that I think if we can integrate that and let girls know that this is something that is very useful, a very useful skill that we typically don't learn in school, I think that's something that is so powerful. So
Right. And I feel like we are going to continue to use it. We use it as adults and as Black women. And we talked about hostile workplaces at the beginning of this conversation, because there's so many things that go through your head when something like that happens. Because it's like, okay, I have to tell you no, but I have to tell you in a way that's not going to intimidate you. Because if you feel intimidated, then you're going to call me aggressive. And then I'm going to be that angry Black woman, which is really unfair when you prompted this response.
instigated.
Yeah.
Recently, I'm so excited. I came across this work by this therapist out of, I think Penn State, is a Black therapist. His name Harold Stevenson or something like that. We'll put it in the show notes what the name is. But he developed like this process to deal with microaggressions. And one of them was, I just love it. He was like, a microaggression happens, right? This is, as a Black woman, happens to me. I go to a safe space with that, somebody that I trust, and I say, this happened. And the safe place goes, how mad are you on a scale of 1 to 10? I'm an 8, right? What do you want to say to that person? And you say all that you want to say to that person, to your safe space person. You get it all out. And then you practice what he calls a healthy clapback. Okay, so considering what the situation is, you're at work, you're at school, you're at whatever, what is a healthy clapback that you can set a boundary and, and it's pretty deep because you have to go into what the power dynamics of the situation is, and all this stuff, and you practice the healthy clapback. So if it happens again, you can say that, or you can go to that person and say, when you touch my hair, I just got to tell you, that was really uncomfortable, and I appreciate you not doing that again, right? You could come back around to it later. But what I loved about his work, what I loved about his work is that we get to practice that. We don't know that intuitively. We have to practice. That's a skill. Setting boundaries is a skill. Knowing what to say is a skill, and how to say it in the tone that don't get you fired or suspended from school, right? But before you could get there, you got to express that legitimate outrage at the insult.
Well, and to Emily's point earlier, that when you mentioned not having those folks maybe in your journey that provided that type of context or outlet or information, I'm still learning about it. And so sometimes when we pose that question about, so what can we do for young people? I think, well, what can we do for ourselves first?
Yeah.
Because if we can't do this for ourselves, it's really hard to then say, I'm going to do this for a young person when we're not practicing it ourselves. Because I'm still learning and growing and knowing when, how best to handle this situation that really pissed me off.
Yeah.
Right, where it's like, okay, still want to work here. I got a mortgage, I got to pay and all that, And you have to learn these strategies of how to navigate that. But then I feel like that starts with ourselves. So I'm just real curious to hear from you, Emily. When people hear certain backgrounds and they hear, masters in clinical psychology, Ph.D., sometimes when it's a person of color, an automatic thought is, wow, that's really impressive.
Mm-hmm.
Because for whatever reason, they feel like women of color, like, oh, wow, that's really impressive because you got that as a woman of color. Mm-hmm. Because I think that'd be impressive if anybody got it. It doesn't matter. I'm like, woo, PhD, girl, that you worked hard for that, right? But I'm just curious, what were your experiences and learnings and growings that you went through as a woman of color in a field that didn't predominantly have people that look like you? And so I'm just like, what types of experiences did you encounter that you've also had to kind of do some soul searching and learn from that kind of relate back to what Tanisa shared with her story? Anything that you could share with us?
Yeah, I think I've been very fortunate to live where I've lived. Where there's a lot of people of color pursuing the same dreams as I am. But I could totally relate to what you're saying in terms of, I remember having this conversation with one of my really, really good friends. She's Guatemalan and she's a school counselor. She went to grad school. And I remember she went to an event, and one of her friend's mom, a white woman, was kind of introducing her like, oh my God, she's a counselor. She went to grad school. It's almost like glorifying her successes because it's like she was supposed to not make it. Like women of color are not supposed to make it. And
like she was a unicorn.
Yeah. And it's like, it's hurtful, and it's like, again, these assumptions that, we're just meant to be in this box and we're not meant to go outside of that. And my personal experience, I think a lot of Filipinos are in like a clinical setting in terms of like being a nurse or a doctor. And I struggled with that a lot because I'm very different from what my family's kind of background is, where a lot of people from my family are from, like nurses or, they work in a hospital actually doing like clinical work. And even that in and of itself, like within my family, I experienced these like, oh my God, PhD, like, you got through it all because, what did you do different that you were able to get through all of these, go through all of these things. But I think, again, I've been very fortunate to have mentors to really get me through these microaggressive kind of comments that I would hear, in PhD school, I was, again, very fortunate to have a mentor. Her name's Latrice Bichon. She is I think she's from LA actually, but she went to school in New Orleans, and then now she's in Memphis. And she's a woman of color. She's Black, and she would always say, like, don't be afraid to use your voice. Don't be afraid to use your voice. Your voice is very powerful. And same thing with my mentor in PhD school. Her name's Brooke. She's a white woman from South Carolina. And, as a very junior faculty at that time, again, not just women of color, but just women in general, she would always also tell me, use your voice. And so I think, again, I've been very lucky to have mentors who have supported me. Yeah. And I think that's one thing that I think, I'm realizing now as we're talking about it is that, we talk about how do we support these women, I would say find a mentor, find a mentor that you not only connect with, not only that you look up to because of their professional work, but the actual values that they have. Because Brooke and I are completely different from each other. Mm-hmm. She's a white woman, from South Carolina. I'm, this brown girl from like Orange County. And so, but I think her core values really are very similar to mine. So I think, again, find a mentor. Like I think, join groups. I think that's get these experiences and hear from other people, hear other people's stories. I think I don't know if did I answer your question?
You did, because part of me was really curious about, it's not easy to go through a path where maybe you didn't have that mentoring or you didn't. So the fact that you can reflect on, you did have some people saying you use your voice, but you did also share in the beginning that sometimes you're afraid to use your voice. And I can relate to that people say, well, you're very confident. That doesn't mean that I feel like I can speak up in certain spaces. And I've learned to read the room and I've learned to assess whether or not it would be safe for me to really be authentic and be myself. And half of the time it isn't. I feel like, yeah, not today, or not with this group, or not with this audience. And it's having to do this little fine dance of like when to set a boundary, like what you were saying, Tanisa, but then also speaking in a way that I need you to hear what I'm saying without you putting me in this type of box of like, oh, you're like the pissed off Latina, or oh, you're hot-blooded because you're like, I don't know what that means, but it's like if I have passion for what I do, then yes, but it's always as a negative. And so I've learned to kind of read those spaces in my professional experience. And so as I was curious, because I'm thinking, when you're in fields of research, typically we are outnumbered as women of color, and we're just not there. And that's why I know we were excited to say, oh, female woman of color researcher, yes, because you bring a very different perspective to the field that I think is missing from a lot of sectors. Yeah. And so kind of looking at we start off talking about a very hurtful experience for girls of color. So I was just curious, when we think of the impact that microaggressions have and just the fact that we may not feel like we could be our authentic selves, what is the public health implications that might be connected to that when we really truly cannot be who we are? The body keeps a score of a lot of our traumatic experiences, right?
Stress.
So just wondering, in your research or in the communities you've worked, what are those dots that we can connect around these things that might seem minor? So when you made the paper cut analogy, I'm thinking, and I love when you said, but if it's 75, that takes a toll. That takes a toll on us physically and emotionally. And so I'm just wondering, what did you find in your research or in your current work that connects it back to that public health perspective?
Yeah, I think stress is, every time we experience these microaggressive behaviors towards us, I think stress is a very big, and I also think that that's another term like resilience, where we throw it without really understanding what the true meaning of it is, not just from like a psychological perspective, but from like a biological perspective. And I'm not a biologist. I'm not, hard sciences it's not my strongest suit. But from my understanding of what stress is doing is, it really impacts your overall health, like whether it's your heart, your organs. And over time, can you just imagine, like, for instance, if I am going through like a very stressful situation, I get a headache. Can you imagine, for instance, a woman of color going through stressors every day? This headache is persistent. And so, and it's not just stress. That's just like a direct impact of these microaggressive, behaviors towards us. Stress can make you, or you could potentially eat, like do certain things like health behaviors, like I know when I'm stressed out, I tend to eat a little bit more. I don't sleep. And so these behaviors, maladaptive behaviors that we end up engaging in, that has an impact on our overall health. If I was one who would eat chocolates or eat not exercise and eat poorly when I'm very, very stressed out, how is that going to impact my, my likelihood of getting, chronic illness in the future? And so I think there is this like connection between, and I think that that's something that I think us researchers are still trying to figure out, are these like mechanisms or pathways in terms of, one of the things that I looked at in my dissertation is perceived discrimination and how is that impacting, your overall like A1C, and in my dissertation, what we found was it wasn't It wasn't significant. I was really
And Emily, I know A1C because my mom's lived with diabetes for a long time, so I'm familiar. But for those who may not know, could you just explain what that is? Because we might have some folks who say, I have no idea. What is she talking about?
So A1C is pretty much how we measure your blood sugar level. So this is like one of the clinical indicators of, how, if you have diabetes, how well you're doing, you're managing your diabetes, or this is one of the first things that they look at to test whether or not you have diabetes. So it's like through blood. And so it's like the amount of sugar in your blood is what it is. But yeah, and I think, but in my dissertation, it's predominantly African-American populations. And so I think there's something about, again, that group, being within your, these within your, people that you connect with, that you share values with. It's something protective about that. So we talk so much about like, oh, if you're stressed out, you're going to do this, you're going to do this. But how about we step back a little bit? What are some of these protective factors that we could kind of touch on, and like, instead of trying so hard to intervene, like, oh, let's just get rid of all discrimination in general. Like, no, what could we do? Because it's not going to go anywhere. And again, I go back to the recognition, like there's just some things that we just can't change, unfortunately. But how could we, do we have any, is there like some type of protective, like kind of factor that we could maybe look at to kind of intervene some of those factors? And social support is one of them. And that's what we found in my dissertation is that, perhaps these people, they're finding that social support is really buffering that effect of, like terrible A1C in this group. And so that's kind of what, in my experience and in my area of research isn't really directly like, like discrimination and, and microaggression. But I think overall stress is,
it's stressful.
It's yeah.
Right.
Yeah.
And so, I think really looking and understanding these mechanisms and how could we, again, buffer those mechanisms. I think that's where research, in my opinion, in my line of research, I think is where it's going. And so it's very promising. It's nice. And so I think it's getting a lot of attention, which is really making me very excited. Again, unfortunately, I'm very excited about these things, but it's like, at least we're somehow moving the needle.
Because finally you feel like the fact that people haven't for centuries not looked at the importance of stress and that weight that people just carry, that has a role to play in our the way we were looking at people from a medical standpoint. And I feel for many years it's been disregarded. And so when we look at certain communities, you think, well, how come in that community they've got a high rate of heart disease or diabetes or early death, and you think, well, maybe we just unpack this a little bit. And you realize, this is a community where things are continuously done to them because you feel like you have the right to do something to them, right? And I've seen it with my own family members. I've seen it even in myself, the toll that can take on a person. And to think that experiencing something that can be small, like a microaggression, that has an impact and can take a toll, like you're saying, if there aren't those buffers. You, Tanisa, were a buffer and a disruptor for those girls. Had they not have that in that weekend experience, that could have been even more traumatic and hurtful to those young people, right? And so I just think of the women we interact with or that we work with or even outside of work. Sometimes we don't have those disruptors for ourselves as adults either. And the systems that we work in don't naturally produce these disruptors. Is go to this workshop, you're going to learn about microaggressions, you're going to learn about the importance of being inclusive and all that. But the systems don't always change. And so then the result, it just takes longer for us to, I think, get to that ultimate goal of we want to move the needle a little bit more.
Yeah. Right. I think we need a toolkit. I'm going to share a story that doesn't put me in the best light, but I don't care.
Besides pulling someone's hair?
Yeah, pulling someone's hair.
You're on a roll.
I'm on a roll. So, I had a mentor. I'm just thinking about how important mentorship was. And we had a relationship that if I thought I was going to lose it at work, just lose it, I could call her, because she was super busy, for a 5-minute reality check. I had to keep it to 5 minutes because she has stuff to do, right? So I would call her and I would say stuff like, I want to punch X in the throat. And this happened. And she's like, okay. You don't want to catch a case. That's not professional.
That won't look good.
Yeah, that won't look good. But I understand. Okay. And I said, I'm going to write an email. Okay. You could write that email, but don't send it till tomorrow morning. Right? So those kind of strategies really, kept food in my kid's mouth, right? Because I had that support. So that was one piece of the toolkit. So based on our conversation, is mentorship, is safe space.
An outlet.
An outlet is having a historical understanding of it so you could depersonalize it and know it's not yours. Understand the science of it. Stress harms you physically. You got to deal with this somehow and not swallow it, because I think society tells us to swallow it. Shake it off. Be a bigger person.
You'll get over it.
You'll get over it. Do we really?
And it's like it's validating these behaviors, right? And if you had, if we're like, oh, it's okay, we'll just talk about it and, amongst ourselves and like not let these people, how are they going to know there's something wrong? They've probably done it multiple times to other people, but because no one's ever said anything to them, they're going to keep doing it, And I think that's one of the things that I think I'm even more empowered to use my voice, because you know what? This person is going to do it to the next person.
Right.
So I think, but then again, it's like, how do we get to these,
How do we get to those people? And I'm just still thinking about what Janedra said about the healthy clapback and being able to practice that, because I do think that's a large part of it as well, is letting them know that this is not okay for you to continue to do.
Right. Yeah. One of the things that because grad school is very, very stressful. you get thrown a lot of stressors that, sometimes are just completely outside of my comfort, of my control, my comfort level. And one of the things that I really learned throughout grad school is how to respond and not react. And that's how I think about, just let it sit for a minute. And I think a lot of times it's so easy for us to just tell someone right away, like this is, but I think sometimes it's hard. And something I tell my mother all the time, because she does this, is step back a little bit, process it, let it sit for like a second, even if, you don't have a lot of time. I know, I understand, because you want to get the message across, but just pause for a second and think about it. And then, it's because I think there is a difference and there's power to responding rather than reacting. Is this person worth it? Is this, and I think if you, but the thing, again, what I struggle with is that, okay, in context, in theory, that sounds all so good, respond, react. But it's like, if you really don't have like that much time, how do you do it? How do you get your message across and without sounding so reactive? And so I think, there's still a lot of work that needs to be done in terms of that. And especially, how could we utilize, as women of color, as girls of color, like, how could we utilize that without, being effective, and two, like very like effective and not being reactive. So I don't know. I think I was doing a lot of mindfulness when I was also in grad school. And I think that's helped me a lot. So those are some of the tools that I think is very helpful, and just breathing, the power of breathing. So I think that's one good way to kind of tell the girls too, like, breathe, like it's okay, like breathe. And then, but yeah, I think I really like that, happy clap too. Happy clap back.
Healthy clap back, yeah.
I appreciate that you said to validate, because I think that would be something else for this toolkit, that sometimes you hesitate to say something, or you feel like, is it me? Or because we've been shut down, I think, in previous experiences where you're thinking, oh, yeah, like you said, oh, you're just being really sensitive today, Tanisa. It's like, really just take a chill pill. But sometimes you feel like, no, this is actually happening.
Right.
I think reminding ourselves as women and practicing that with the girls we work with, that no, that shit that just happened was not in your head.
It
was not in your head. Them taking pictures like they were at the zoo, that actually happened. And so really, because sometimes we try to minimize it, to say, oh,
Ooh, Gabby
maybe
said a
they
bad
just
word.
I know.
Gabby said a bad word.
Well, I have a potty mouth. I try to control myself when I'm
I don't.
getting recorded. But
Okay.
I think it's important to let women know when you're feeling it.
It's real.
Your spidey
It's
sense
real.
is not.
It's real.
You're correct.
Yes, and I'm thinking about, I was in line for a bagel one time, and here comes a lady that just stands right in front of me. And you have to do that, like, look around sometimes. Like, did she just?
Yeah, am I invisible? How did that happen?
Right. And then, seeing other faces was like, okay, yeah, it's not me.
Yep.
Ma'am, I was in line. Oh, yeah. Oh, excuse you. Like, what the heck? So I think sometimes also just kind of, having those people to validate validate it on your own, because if you're feeling it, then it's true.
Yeah.
But in the
Trust your gut.
moment when you're still trying to process, like, is this happening? And then looking around, and if other people are giving you that
It's happening.
response, like, girl, yes,
It's really happening.
It is happening. Then take action.
Yeah.
Definitely speak up, because it's unacceptable.
And maybe a takeaway too could be, when I was with students is when I felt like I gotta put up or shut up because they're watching me.
Yeah.
And I have to set this example. And as much as I want to really give this teacher a piece of my mind,
Yeah.
I know that my 10 girls in my girls group are watching me. And I'm like,
What's she gonna do? What's she gonna do? What's
I
she
gotta
gonna
show
do?
them how you do this professionally.
The healthy clapback.
Yes. And so maybe that can be a reminder for some of our listeners too, is we are role modeling all of the time. And
Right.
it could be for the bystander at that bagel shop to say, wow, that woman, I'm glad that she spoke up. Maybe I need to do that the next time that I'm disregarded and completely ignored, and no one's, kind of said anything on my behalf, because people are watching even when we don't think that they are.
Yeah.
Young people are watching, other adults are watching who maybe aren't even, maybe also as adults still need to do some learning and growing on their own. And so I'm finding that might be helpful perhaps for some people, because like I said, when I was with young students, I realized they kept me in control. And that's the reason why I held it together, because I knew I'm trying to have them utilize these skills. And if I lose it right now, all of my wonderful lessons have gone out the window of like, you just lost your cool, Ms. Delgado, because that lady teacher. I'm like, oh no. Oh, I'm mad inside. And I
Yeah.
will process this. But there's a way to do this when you are in public or in a school setting or whatever. And
Yeah.
so just letting folks know people are watching.
Yeah.
And
it's
that's a
important.
skill to like look at the environment and measure your response to the environment, right?
Like reading the room.
Yes.
Like you were saying,
Yes.
reading the room.
Yeah,
And what is your healthy outlet,
Yeah, we need healthy outlets because this stuff is like wild.
Yeah.
I mean, looking through the windows. That means that still enrages me.
And having the whole they give back scholarship presentation as though they gave us a scholarship. And I was like, we paid to be here. What is happening right
that
now?
assumption, right? We talked about this
Right.
with one of our guests, Dr. Renita Ray, where she talked about people have this assumption that when you're, including the girl of color in a conversation, it's automatically going to be negative. Or, like I said earlier, oh my God, it's so impressive.
Yeah. Against all odds.
Yes, and
Yeah.
it's like, why do you
Like-
all default? It's like, oh, that's so funny. That's how myopic your perspective is. But why would you not say that about a white person? You say, oh, that's what's expected. Well, that's what should be expected of everyone. How about we just raise the
Right,
bar for
right.
everyone?
Yeah.
Just set the expectation higher.
Yeah, as though we can't afford to go camping.
Yeah.
Yeah, I just remember, I'm just thinking about my first try at grad school. I did complete a program, but I had a lost year that I rarely talk about. And I was struggling. My mom just died, and I just was not academically producing at all. And I had this professor say to me, I know you're probably a first-generation college student, and, this is hard, but, And I looked at him, I said, my grandmama went to college. My daddy went to college. My mama went to college, and she has a doctorate. No. I mean, but I remember that moment that the assumption was that box. He had, and I had to say to him, I'm not performing because I'm struggling, not because
I can't perform.
I can't, or I don't have the role models, or I'm the first, which are added barriers that I completely acknowledge. And it wasn't my story because in my family, you went to college. It was assumed,
Yeah.
It was my little brother that said, no, I ain't doing it. Right? And it was scandal. What? But those boxes and, and that's a microaggression too. Like, can you see me as a person that has a variety? Really, and it's a stereotype of a whole culture, right?
Mm-hmm. Absolutely. So, Dr. SanDiego, as we wrap up, what is a wish that you have for the communities that you are privileged to work with, that are part of your ongoing research and learnings? What's a wish that you have for those groups that you get to serve?
Yeah. I think my biggest wish is, and I think we talked about it throughout this session, is just for them to be able to use their voice and validate, and not just, not validate in the sense that, you have to have a role model or a mentor to validate your actions are okay, your feelings are okay, but also self-validate, learn how to self-validate, and, learn that, this is something that you're going through. It exists. It's in your stomach, like it's hurting your stomach for a reason. It's hurting your heart for a reason. And it's okay. It's okay to use your voice. And, that's something that I'm learning right now as an adult. Really the first time out of grad school, I'm working, and kind of a message to like girls of color is that learning these things now, that's what's going to translate when you're an adult. This isn't like just a skill that you learn in school. This is something that you're going to carry throughout, your adulthood. And so really soak in everything that you're learning from your mentors, your role models. But yeah, I think I wish that someone had told me it's okay to say no. It's okay to set your boundaries. It's okay to seek out support. But sometimes we just hold it in. We don't, so we know that there's something wrong, but we don't try to seek out support, whether that's going to make us look weak, whether that's going to make us look like we're not competent. It's okay to be weak. It's okay to be competent. So also, it's okay to be mad. So I think validating those, not just positive, feelings that we are feeling, but also the negative feelings that are going through our hearts and our minds and our soul. I think that's very important. So just recognizing, validating, seeking out support, and really utilizing your voice. I think that's a key takeaway that I try to practice every day. So yeah.
Well, we thank you. You are a badass Filipino woman. You really are. You really are. Own that. Oh, you really just should own that. And that should be part of the title on your business card.
It's a strength, is what I told, our friend. I said, me being a woman of color, I see it as a strength.
Absolutely.
This curriculum that we're doing, it wouldn't have happened if it wasn't for me. So you know what? Own it. And that's another thing, validate and own it.
Right.
Yeah.
Own your color.
Yep.
Absolutely.
Own your culture. So.
Yeah.
Absolutely. Well, we can't thank you enough. We wish you much success in your ongoing research. And again, just best of luck moving forward. We appreciate your time. And that does it for us today on another episode of All About Girls of Color.
Well, thank you.
Thank you
so much.
This podcast is made possible by the California Commission on the Status of Women and Girls. Additional sponsors include SanDiego County Employees Charitable Organization. You can access all episodes and connect with us via email at allaboutgirlsofcolor.com.